February 27th, 2020 became a defining moment for Nigeria when the first case of COVID-19 was recorded. Since then, the country has witnessed a spike in the number of confirmed cases in the country, but gradually and consistently, the country has also witnessed that every day and every month, the numbers of confirmed cases have been dropping. For these facts, the Presidential Task Force on COVID-19 announced Nigeria's transition into the third phase of the ease of restrictions for a period of 4 weeks with effect from Friday, 4th September. However, understanding how to manage and control the challenges of the coronavirus pandemic in the country and the entire world, the PTF believes Nigeria is ready to enter this third phase of the ease lockdown, but not quite yet ready for a full reopening of economic activities. But then, since Nigeria has recorded sufficient progress to warrant a relaxation of the restrictions in some areas, the task force, however, says the COVID-19 protocols remain in place. During this new phase, a nationwide curfew is still in force, but now from 12 midnight to 4 a.m. All intra and interstate restrictions on road and rail transport are lifted, and international flights are scheduled to resume on Saturday. However, not all the international flights are approved to fly into Nigerian airspace, and those approved are to observe strict guidelines and protocols. Additionally, all restriction on marketplaces, amusement parks, gyms, and event centers are lifted with half capacities to be adhered to. Meanwhile, bars and nightclubs are yet to be approved for reopening, as public servants below grade level 12 are still advised to work from home. During elections, no face masks, no voting. Now, what are the pros and cons as we enter phase 3 of the eased lockdown? Answers shortly on this edition of Nigeria Today. Welcome, I am Dennis Adigunloye. All right, joining us on the program tonight is another of our regulars in person of Dr. Isaac Egbuja, a public health specialist. Welcome once again to Nigeria Today.
You're welcome. Good evening.
All right, phase 3 of the eased lockdown. As a public health specialist, what does this say to you about the current situation as regards the potential or threat of COVID-19?
Well, what it does say is the fact that we've made reasonable progress. We are still making good progress. It means that the measures that have been put in place right from the beginning of this pandemic are working. However, there are still some challenges. There are still some obstacles to getting to where we want to be. And what it does mean is that if we continue the way we've been doing, and we improve on especially certain areas, which I'm sure we're going to be talking about, we will get there soon.
All right. In terms of health, what do you think the health sector, I mean, no doubt lots of commendations have been coming for health workers. They've been referred to as the frontline workers in this fight against COVID-19. What can be done, in your view, differently to handle the situation?
Well, I think you remind me now, I always start by thanking health workers wherever they are, and whatever level, whatever category, doctors, nurses, lab scientists, whoever, pharmacists, everybody, support staff, drivers. We like to thank everybody, and I would like us to continue to appreciate them and congratulate them, encourage them. They have done very well. Many of them have made a lot of sacrifices, and we should acknowledge that. In terms of public health, we still have a lot to do. We are not yet in the position to relax and feel comfortable. We are supposed to feel relatively uncomfortable for now until we get to some point further than where we are. But it is encouraging, and for the health staff, it means that they should be encouraged that the efforts they have been putting in are working. and that their sacrifices are not in vain. If, for example, it has been the other way around, and that instead of the numbers decreasing, they are increasing, and instead of us getting out of the wood bit by bit, we are sinking deeper, they will be discouraged. But since this is the way it is going, I think that they should be encouraged, and they should continue what they are doing. The health authorities should continue enforcing the measures that they have put in place. The public should continue to obey the rules that have been put forward for us to obey, and they should still, importantly, adhere to the restrictions that are in place, and keep to the rules of wearing masks in public places. In particular, anytime you get out of your house, you wear your mask, you still wash your hands as frequently as possible, and you still maintain physical distancing from other people. You and I are physically distant from each other right now. That's how people are supposed to be.
Yep.
Even though worship places have been allowed to operate, they should still operate at very minimal level. People should still sit distant from each other and make sure that they keep the rules, make sure that if there is anybody that needs to go to such place, first they check the temperature, secondly they sanitize their hands, wash their hands, and sanitize their hands before they go inside, and keep to the rules. No hugging, no close contacts for now.
Yeah, all that you've said is certainly all well and good, but in your observations over the last, let's say, few weeks, would you say Nigerians have been adhering to these basic guidelines of social distancing, not having too much physical contact? I mean, in my own personal experience, I feel that people have become a bit complacent, nonchalant, and this carefree attitude that it really doesn't matter anymore, that this COVID-19 is now becoming a thing of the past. Would you agree with that?
No, I don't agree with that. Unfortunately, we're not doing too well as a public. As a society, we started very well. We responded very well. We cooperated very well. But in the recent times, especially the last 2 months, right after June, I would say July, August, September, things have changed a little bit. People have relaxed far more than they should have. People are more careless than they should be. They are not wearing their face masks. Sometimes you meet somebody and you ask him, where is your face mask? He says, it's in the car. The virus is not just in the car, it's everywhere. Sometimes they say, it's in my pocket. The virus is not in your pocket, and it is not your pocket that should be protected. It is your nose and mouth that should be protected. As a matter of fact, your eyes too. Many people are not washing their hands as frequently as they should. The only part that I have observed that is good is the fact that people are not shaking hands the way they used to. They are doing fairly well in that area. They are not shaking hands. They are touching elbow to elbow. I think that has become a routine now. I wish that they would do more than that, and that they would obey the other rules, especially wearing of the masks in the marketplaces, in public places. And for those who take public transport, it is very, very mandatory. You don't know who the next passenger is, and whether or not he or she is infected. And even though you trust yourself, there's no way you should trust somebody else that you don't know. And even if you know the person, you have no idea of knowing whether or not they are infected, because you don't have eyeglasses that can see the virus.
And it's not tattooed on your forehead, as they say.
No, it's not. I'm not very impressed with our attitude as far as that is concerned, I must say. I think that the authorities have been crying a lot. The ministries of health at the state level, the Federal Ministry of Health, NCDC, the Presidential Task Force, everybody has been singing the same one song. And I think that it should sink into everybody's heads and minds. And we should do better than we are doing.
Given the this phase 3 that we have entered into, obviously the restrictions are further relaxed. Does this give you even greater concern on the part of how Nigerians are going to conduct themselves going forward?
Yes, I'm personally very concerned. I'm a little concerned because if we go the way we are going, we might get into trouble. I keep saying we are still in the woods. We've not gotten out of the woods yet, meaning we've not gotten out of this problem yet. It is not over, and we should not pretend that it is over. And the worst thing that would happen is when you think there is no enemy, and there is an enemy, that's when the enemy will get you very well.
Yep.
It will hit you below the belt, and it will be disastrous.
When you least expect it.
And for example, when people go to the market or go to the worship places or just go anywhere, and they relax, and the 1 person, 2 persons, 3, 4 get infected, it will spread around. And it will be the way we started, the way it started coming up, it will start spreading out again. And this is exactly what my concern is.
All right, let's focus a little now on the, no doubt the PTF, Presidential Task Force on COVID-19, did its due diligence before announcing resumption of international flights in Saturday, that's tomorrow. Given what we've seen in other countries in terms of spikes in COVID-19 cases, just give us your concerns that you may have concerning flights that will be resuming, international flights that will be resuming into the country.
Well, let me first of all thank the Presidential Task Force. I think they have done very well. Before they relaxed the situation to a point where they are now going to allow international flights, they have done quite a bit of research work and background checks on countries. And if you notice, it is not all airlines that are allowed to come into the country. It's a select few for now. We will see how that goes. If you notice the way they started with domestic flights, and very few flights between Abuja and Lagos. Then they expanded. Then now they are thinking of international flights. And even now that international flights will be allowed, it is not all airlines. It is only some. And I hope too that the measures put in place, meaning you must be tested a few days before you travel from the country of origin of your disembarkment. And when you arrive here, you'll be checked. You will still be isolated. We've not changed that rule yet, and it should remain in place, because if people are not isolated and checked, it could be disaster again. So that is good. If people keep to the rules, and the civil aviation personnel or staff are working hard as they are now, observing, keeping to the rules, not relaxing anything, not changing any rules, not obeying any person, not respecting any person who claims or pretends to be a VIP, I think things would go well. We still have to be very cautious. We still have to recognize the fact that if we make mistakes, we could go to where we started from. And so precaution is the word to use.
We certainly don't want to go back to square one.
No.
All right, the program is Nigeria Today. We are discussing the phase 3 of the ease lockdown announced by the PTF, which came into force today. We'll take a break now. Don't go away. We'll be right back.
The number of the COVID-19 cases in Nigeria is increasing daily, with many more tests ongoing. The battle of testing, isolating, treating, and attending to the affected persons rests heavily on the shoulders of our health workers, constantly putting their lives on the line and at risk to contain this virus, save and protect the lives of millions of Nigerians. To these health workers, we at the Nigerian Television Authority, NTA, on behalf of millions of Nigerians, say a big thank you for all that you have done and are doing. To the security agencies enforcing the lockdown and every other frontliner, we say thank you for putting your lives on the line to save ours. There is no amount of words that can quantify our gratitude. Thank you. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
All right, Joe, welcome back. If you are just joining us, the program is Nigeria Today, and our topic is the phase 3 of the ease lockdown in the country. Our guest is Dr. Isaac Egbuja, a public health specialist. Doctor, just help me and maybe the viewers understand the reasoning behind how, why some international flights have been allowed in or are going to be allowed in and some are not being allowed in. What's the rationale behind that?
Well, it's because of the countries where those airlines are coming from. Mm-hmm. If an airline belongs to a country A, where the situation has not changed too much and is not yet good enough for us to trust that they will not be bringing in the virus, then it will be very risky to allow airlines from such country A to come into the country. If, however, there's country B, where the situation is good, it has improved because every country has been affected, and they have taken reasonable precautions. The number of cases in those countries have reduced drastically. The lockdown in those countries have been relaxed to a point where they can operate their own airlines, and there have been no documented, observed serious cases from such activities. Then airlines from country B can come to Nigeria. If the country C has a worse situation than the two that I have mentioned, where things are really going very bad, Nigeria would not even think of allowing any airline from such country. That is why I started by saying that before the Presidential Task Force relaxed the rules on international flights, they have done their background checks, they have got their informations, they have done their research, and it is only temporary. If they observe as things go on that countries where airlines are coming from start to have problems, they will, I'm sure, readjust again.
Sure.
On the other hand, too, if countries that have so much problem right now that airlines from those countries cannot yet come to Nigeria, especially some countries in Europe, if they observe that they have improved and that their situation has improved to a point where they are like us or better, why not? They would allow them. I'm sure they'll be reviewing these things from time to time.
Yep.
Nothing is static.
For sure. And no doubt things will change and adjust. All right, some people may not be happy about this ease of lockdown not coming to their doorstep, if you like, bars, nightclubs, for obvious reasons. The PTF has decided that such venues are not ready for gatherings. I'm sure you would agree with that.
I agree, totally agree with them. Yes, those people are crying because of the economy. They want to earn money. Everybody knows that. They want to earn a living. There are a lot of people who work in those places who are not going to work now, and therefore they don't have good means of livelihood. We are looking at livelihood with comparing it with safety. Yes, we want to live, but we want to do it with precaution and with reasonable certainty that we are not going to incur some problem on ourselves. I feel sorry for those places, but much that I do, that's not a reason for us to change the rules. We still have to keep the rules, unfortunately.
Very important. All right, the ongoing global efforts in the generation of a vaccine for this COVID-19 showing promising results. What role is Nigeria playing and its contribution so far to the rest of the world in this regard?
Well, Nigeria is a member of the international agencies that are working on vaccines. For example, WHO. Nigeria is partnering with other countries that are also working on vaccines. And Nigerian scientists are also working. They have started, the Nigerian Institute for Medical Research, for example, has started work. And I'm sure NIPRID, the Nigerian Institute for Pharmaceutical Research and Development, which is here in Abuja, is also working. I think that this kind of partnership and cooperation and collaboration that we are doing as a country with other agencies, with other countries, and with agencies, we are going to yield good results. And I would want to use this opportunity to advocate that a lot of funds are given to our research institutes, especially those two, the Nigerian Institute for Medical Research in Yaba, Lagos, and the Nigerian Institute for Pharmaceutical Research and Development here in Abuja. If they have more money, they can do much more than they are doing. Any of us I have been privileged to be a chairman of the managing, of the governing board of NIMA, the Nigerian Institute for Medical Research, and I know that there are lots of capable hands there. There are lots of good scientists there, and the same in NIPRID, the Nigerian Institute for Pharmaceutical Research and Development. All they need is one, encouragement, two, funds. They need funds to be able to do the research that they should be doing. And if you combine those with, for example, the National Veterinary Research Institute in VOM, which is already producing vaccines, and they collaborate and cooperate with each other, we should be able to produce vaccines for COVID-19 and other viruses, other diseases as soon as possible.
All right. Stigmatization, it's still maybe a bit of an issue when it comes to COVID-19. Those who may be coming in from abroad or other countries, is there any concern you may have as to stigmatization of those who may be coming in by Nigerians?
I think there is even stigmatization of those who are already in the country, who have been known to have contacted the virus. I would encourage people not to run away from anybody because they come from another country. You should be careful, I agree. You should be cautious, I agree, but not to stigmatize them and say, and look at them like lepers. When they come near you, you avoid them and you run away from them, especially if those people are of different color or of different nationality. They will feel very embarrassed, and it is not good for us.
All right, just to harp on this point again, we've entered phase 3. Restrictions are becoming more relaxed. What's your message to Nigerians in view of this relaxation? How should they conduct themselves and take ownership and responsibility as this challenge continues? My
message is still the same. I want us to take it very cautiously, to be happy that the measures are being relaxed, but to be conscious of the fact that we are still in the woods, we are still in trouble. We've not completely gotten out of the trouble. And therefore, people should not relax. People should still obey all the rules. All, not some. All the rules that are put out. At the beginning of the lockdown, people were not even allowed to go anywhere at all. It was relaxed. Some of the conditions have been relaxed. Those ones we should try to appreciate. But to go beyond where we are supposed to go or we are supposed to be will be very disastrous. So I encourage everybody and I advise everybody, keep to the rules, wash your hands as frequently as possible, wear your masks whenever you're out of your house and you're going anywhere. Make sure that you keep physical distancing from people, at least 3 feet, 2 feet, meter, 2 meters away from your next neighbor. Especially people who are going to the markets, crowded places, places of worship. We should still be very careful. If we misbehave, I'm sorry to use that word, if we do and we're not disciplined, the government will have no choice but to reverse to the stage 2 that we were, which we don't pray for. So my advice is, keep to the rules so that we'll keep making progress. Absolutely, very good advice, and Nigerians take heed of that advice from Dr. Isaac Egboja. Thanks once again for being on Nigeria Today and sharing your thoughts with us, public health specialist. We hope to have you back very soon once again. My pleasure. Good evening. All right, and thanks to you out there for watching. Nigeria Today is live every weekday at 7:30 in the evening. I'm Dennis Adignoye. Thanks for spending your time with us. We'll be back again in the new week. Have a good weekend.
anywhere.